An ugly legal battle is underway between Vancouver Coastal Health and the operator of two of its urgent and primary care centres. The health authority is trying to take them over, alleging mismanagement. But the company says it's owed millions in services to patients. CTV's Penny Daflos explains.
On a normal day, this room would be full of patients waiting for ultrasounds and lab tests, but medical diagnostics that ran all through the pandemic are now halted.
It took aggressive and unnecessary legal action from Vancouver Coastal to close down our services for the first time.
Seymour Health's urgent and primary care centres in Vancouver and the North Shore are now in legal limbo. Vancouver Coastal Health has gone to court claiming $6.8 million in unpaid loans and rent, shocking employees with surprise visits to announce they're taking over.
This was very disruptive to patient care and very upsetting to the staff, who are quite loyal, having worked with Seymour for many years.
This is not a step or a measure that helps improve access to primary care in British Columbia right now. This is a tactical move in the interest of health authorities and the Ministry of Health alone.
Like all doctors' visits, the health authority pays for each patient. But after the province asked them to open a UPCC, Seymour invested millions in diagnostic equipment to carry out the mandate of diverting non-emergency cases from slammed hospitals.
We're doing them faster.
Seymour claims it had a verbal agreement with the health authority to cover testing costs. They've now launched a countersuit for millions of dollars worth of diagnostics provided to patients, which Vancouver Coastal Health hasn't paid for.
And we've been providing funding for those services.
But only $180,000 worth for the whole year, which is not very much. I mean, I think that they put through more than that in a single month.
I think those funding, the way we arrived at those services were, types of services that patients would require in those urgent centers. And if patients require those services or more of those services, then there are other ways that we can handle and support those patients, which includes transfers to other clinics or transfers to emergency.
You're saying that when they ran out of money, they should have just sent them across the street to St. Paul's that's already super busy?
Yes, we're first of all very happy with and complimentary about the work our people do at those services at the UPC centers. They are very well attended. They're very well staffed. They've been very successful in our eyes.
And Penny is here now. And Penny, these urgent care centers, they were open because so many people don't have family doctors. So it's a little confusing. If the health authority takes over the clinics, are more patients left without a family doctor in urgent care?
It's really hard to say this early in the game, Mi-jung. In the court filings, Vancouver Coastal is trying to sell the clinics as soon as possible to get their money back because it anticipates a lot of the staff might quit, given how this is all played out. Both sides are saying that they want to keep providing care, and the doors are open for now, but it's very possible this will leave more patients with fewer options as our hospitals struggle with major volume, and as you say, so many people are without a family doctor.
Okay, thank you, Penny.
You bet.